Research reveals that 1.6 million to 3.8 million concussions occur each year. 5 to 10% of athletes will experience a concussion in any given sport. If you are or were an athlete, you are part of this percentage. In 2016, National Review magazine stated that football isn't a contact sport but a collision sport. Football is the most common sport with concussion risk for men. For every player, there is a 75% chance he will suffer a blow to the head resulting in a concussion. On average, during a single season, a professional football player will receive an estimated 900 to 1,500 blows to the head. The adult brain is a 3-pound organ that basically floats inside the skull. It is surrounded by fluid that serves as a shock absorber from minor impacts. When the brain moves rapidly inside of the skull, a concussion has occurred. A concussion is considered a brain injury. It is defined as a complex pathophysiological process that affects the brain, typically caused by trauma to the brain. It is usually caused by a direct blow to the head or an indirect blow to the body. Different signs and symptoms of concussions may include physical pain in the head, nausea, difficulty with concentration or memory, headaches, difficulty sleeping or staying asleep, a change in appetite, lower energy levels, balance problems, sensitivity to light or noise, blurred vision, dizziness, drowsiness, and confusion. Mental Health Weekly Digest said that NFL players have an increased risk of depression at an older age due to brain damage from concussions. Before returning to play, an athlete must undergo many different types of tests given by a doctor. Some different things that go into the doctor's decision to clear an athlete to play include the player's medical history, a player's concussion history, a player's medicine use, a player's ability to stand and keep their balance, and the player's ability to pay attention and answer questions that test learning and memory. Research suggests that a player who returns to play after suffering a concussion is 1 to 2 times more likely to receive a second concussion. If a player has suffered 2 concussions, they are 2 to 4 times more likely to suffer a third. And players who have had over 3 concussions can be up to 9 times more likely to receive a fourth. It is very important for doctors and for the people responsible for treating people with concussions to stay up to date on new information and the latest research on prevention and treatment. Tests like MRIs, PET scans, and CT scans are helpful in determining the severity and structural damages in the brain after a traumatic injury. Most of these types of tests reveal internal bleeding and skull fractures. States News Service stated that the NFL players, including Dave Duerson, were donating their brain to the NFL Brain Bank for research. Long-term effects of multiple concussions are currently being studied by researchers and doctors all over the world. It is very important that an individual fully recovers from a concussion before returning too quickly and risking a second. Failing to do so can result in greater damages. PR Newswire informed readers that the NFL agreed to pay hundreds of millions of dollars for treatments of almost 5,000 retired NFL players who suffer from brain conditions brought on by concussions that happened on the field. Although there is no way to prevent concussions, there are new rules being enforced to help decrease the chance of brain injury.